Hello, my name is Jen, and I'm currently doing an online residency program module that is focused on, let me share the screen with you, that is focused on wound irrigation solutions, wound irrigation subject. Okay, let's start from the very beginning. I've already started it. All right, introduction. Wound irrigation and packing procedures are practiced to promote wound healing. However, it can be very uncomfortable for the patient. It is important for the healthcare professionals performing this procedure to be confident in the step list, as well as identifying potential wound infections. If the procedure is not done correctly, the risk of infection increases and the patient discomfort increases. In order to complete this course, you must pass the assessment with a score of 70% or higher in a simulation with a score of 100. Learning objectives. In this course, you will be educated on the indications and contraindications of wound irrigation and packing. You'll also walk through the indications of high and low pressure for irrigation, as well as types of dressings used for packing wound cavities. Upon completion of this course, you should be able to identify the types of irrigation solutions used and their potential complications, identify the types of dressings used for wound packing, describe the indications, contraindications, and precautions of wound irrigation and packing, select the appropriate equipment for wound irrigation based on the size and expected clinical outcome. Describe the difference between high pressure versus low pressure wound irrigation. All right, wound irrigation solutions. Wound irrigation is defined as a steady flow solution across an open wound surface to achieve wound hydration, remove deeper debris, and assist with visual examination. There are several different types of solution that can be used for wound irrigation. First is normal saline. Normal saline is the most commonly used irrigation solution as it contains the lowest toxicity. However, it must be noted that it has been shown to not cleanse necrotic wounds as effectively as other solutions. Normal saline is only usable within 24 hours of opening. Be sure to check the label of the expiration or last date and time used before performing irrigation. Sterile water. Sterile water is often used in countries that do not have financial resources to purchase normal saline solutions. It does not contain any antimicrobial or bacteriostatic agents. It is not recommended for use during surgical procedures as it may cause hemolysis or the destruction of red blood cells. Potable water. Potable water is only used in the event that normal saline and sterile water are not available. Povidone iodine. Povidone iodine shows similar results as the use of normal saline. The disadvantage to using this solution is the cytotoxicity to healthy cells and tissues, as well as the potential for skin discoloration. Hydrogen peroxide. There is very limited data to support the hydrogen peroxide's effect on wound healing. However, if the solution is used at full strength, it has been shown to be a successful solution for the debridement of necrotic tissue. If used in this manner, an irrigation with normal saline is recommended. Do not use this method when the wound has sinus tracts. Sodium hypochlorite is typically used in pressure ulcers with necrotic tissue and at times over cancer growths. Like povidone iodine, this solution is cytotoxic to healthy cells and tissues. Its use should be limited to no more than 10 consecutive days. Oh. Okay, wound irrigation and packing, indications, contraindications, precautions. Indications. All wounds should be irrigated regardless of the visual evidence of the debris or infection. The type of irrigation and delivery is dependent upon the size of the wound cavity. Wounds that have severe active bleeding should not be irrigated. Pulse lavage should not be used when the below are exposed: blood vessels, nerves, tendons, bone. It is important to note that patients with sensory impairment will be unable to give feedback related to pain. This will make it difficult as a healthcare professional to judge if proper technique is being used. High pressure versus low pressure. The pressure needed to clean the wound relies on the wound characteristics as well as the expected clinical outcome. Once the pressure needed has been confirmed, you will then select the device that will deliver the expected pressure. High pressure. High pressure should be used when the wound base shows presence of necrotic tissue, as fibrins loss, debris or other particularly matter, significant material burden. High pressure should be used when the expected clinical outcome is to loosen, soften, and remove devitalized tissue from wound to separate the eschar from fibrotic tissue, to separate fibrotic tissue from granulating base. If high pressure is required, the following device can be used. Delivery 35 ml syringe with a flexible 19 gauge angiocatheter pulse lavage. In both high pressure and low, the amount of solution needed is dependent on the approximate volume of the wound. The bigger the wound, the more solution you will use. Low pressure. Low pressure should be used when the wound base shows pressure of granulation tissue or intraepithelial cells. None or minimum serous or serous sanguineous exudate. Low pressure should be used when the expected clinical outcome is to prevent trauma, to visible wound pulse, to remove wound care, product residue. If low pressure is required, the following items can be used. Pouring saline directly from bottle, bulb syringe, piston syringe. In both high pressure and low, the amount of solution needed is dependent on the approximate volume of the wound. The bigger the wound, the more solution will use. Types of wound packing. Wound packing is a technique used to fill the dead spaces of the wound to facilitate the removal of exudate and debris. It also encourages the growth of granulation tissue from the base of the wound to prevent abscess formation and premature closure. The types of material can be used to pack a wound care are gauze, ribbon dressings, hydrofiber dressings, alginate dressings, foam dressings. The type of material used will depend upon the size and wound, the amount of drainage, and how frequently the packing will be changed. Okay, getting.
Welcome to the Clinical VR Web Simulator quick tutorial. For the best simulation experience, please turn on your computer speakers or headphones. You will experience different types of interactivity within the simulations. Certain types of interactions require you to click and hold the mouse button, such as inserting this needle or applying disinfectant. Other interactions require you to simply click on specific objects within the scene and observe the result. After selecting certain objects, you will notice that they appear in the In Use window. In this example, you're picking up equipment and placing it in the correct location. You can refer to the side panel if you need to review the current instructions. When you have completed a step, click Proceed to move on to the next step. You can click the Reset button to repeat any step from the beginning. Good luck and welcome to Clinical VR.
All right, clinical VR. This is awesome. All right, evidence-based simulation. Following simulation is based on evidence, research, and a mastery learning strategy. Mastery learning is a teaching approach that allows the participant enough time to meet the desired learning outcomes, and through repetition of critical steps, mastery is confirmed. All critical steps are evidence-based, which can be gleaned from peer-reviewed literature, expert clinician experience, or quality data. A traditional teaching approach gives the participant feedback at the end of learning activity and is a single measure of performance. What sets master learning apart from traditional instructions is feedback and corrective actions given throughout the learning activity. This approach helps to identify what content was not mastered and then provides customized instruction to match the learning gap. Once the corrective is provided, the student is given another opportunity to complete the critical steps, again confirming mastery. Very interesting. Patient information. Okay, let me screenshot that. Okay, patient information. Mary Smith is a 35-year-old female admitted in emergency room of an acute care medical center after developing wound drainage from her abdominal incision as a complication of a streptococcus infection. So Mary Smith is a 35-year-old female admitted to the emergency room of an acute care medical center after developing wound drainage from her abdominal incision as a complication of a streptococcus infection. She had a bowel resection 1 week ago. The patient went to the operating room for surgical debridement to control the infection, which resulted in an open abdominal wound. Primary assessment of the post-op wound after one surgical debridement revealed a wound with clear wound edges and a clean red moist wound bed. The wound measured 4 centimeters in length, 3 centimeters wide, and 2 centimeters deep. To promote moist wound healing, the team managed wound drainage by irrigating the wound with normal saline and packing with wet to dry dressings 3 times daily. Subsequent assessments found granulating tissue covering the open abdominal wound. Oh no.
Observe and assess the dressing for drainage and odor to evaluate the healing process. Once complete, fold dressings and remove gloves inside out over them. This will prevent cross-contamination due to the leaking of fluids. Discard the gloves and soil dressings into the biohazard bag. Confirm that the type and quantity of removed dressings corresponds to the previously documented dressing change. If there is a concern that dressing or packing material may have been left in the wound, follow your institution's protocol. Select the hand to observe the soiled dressings. Click and drag the right glove to remove and roll soiled dressings within. Repeat this action for the left glove. Discard the gloves into the biohazard bag.
All right. Reset.
Observe and assess the dressing for drainage and odor to evaluate the healing process. Once complete, fold dressings and remove gloves inside out over them. This will prevent cross-contamination due to the leaking of fluids. Discard the gloves and soil dressings into the biohazard bag. Confirm that the type and quantity of removed dressings corresponds to the previously documented dressing change. If there is a concern that dressing or packing material may have been left in the wound, follow your institution's protocol. Select the hand to observe the soiled dressings. Click and drag the right glove to remove and roll soiled dressings within. Repeat this action for the left glove. Discard the gloves into the biohazard bag.
Okay. Observe, assess, manage.
Observe and assess the dressing for drainage and odor to evaluate the healing process. Once complete, fold dressings and remove gloves inside out over them. This will prevent cross-contamination due to the leaking of fluids. Discard the gloves and soil dressings into the biohazard bag. Confirm that the type and quantity of removed dressings corresponds to the previously documented dressing change. If there is a concern that dressing or packing material may have been left in the wound, follow your institution's protocol. Select the hand to observe the soiled dressings. Click and drag the right glove to remove and roll soiled dressings within. Repeat this action for the left glove. Discard the gloves into the biohazard bag.
Okay, I will continue later. Just a moment. Exit full screen. I will continue later. Okay. This is the end of part 1.